Hello, welcome. Hello, my name is Jody Scholes, and I am your instructor for the MBLEX Review course. I am so glad you guys are here. You guys and gals are here. This is a time where we come together once a week to study specifically for the MBLEX, and we do that through this class, and this class has three distinct sections. One is that we're going to talk a little bit about the test. Uh, because it's been my experience, and it'll be your experience, that understanding the test is just as important as actually having the knowledge of the test. So understanding the MBLEX, understanding the process that you've either gone through or are going to go through, and how you can control what you can control to be successful with the test. That's part one of our class. And honestly, you guys, just know that that is as important as your knowledge of anatomy, of physiology, of kinesiology, of ethics. So that's part one, is understanding the MBLEX. Part two is our learning. So today we have a class about ethics. We typically do an 8-week cycle in our class because there are 8 topics that you'll need to know for the MBLEX. And so we cover each one of those specifically. We cover anatomy and physiology and kinesiology in terms of upper and lower body. But today you get your ethics. Woo-hoo! We get to go over some terms, and we got to dust off your memories and bring a few new terms into the mix to our actual learning or relearning or remembering. It's all three. You're relearning, remembering, and learning all at the same time for class. In this class, that's again going to specifically prepare you to be at your best as a licensed massage therapist, at your best when you go to take the MBLEX. So that's part two, is the learning. And then part three of our class is we dissect questions. And for those of you who have been with me for a few weeks, a few months, you're like, ugh, dissecting questions. But really, it's, memory, repetition. What is that saying? Performance, preparation, proper preparation prevents poor performance. That one, there we go. Proper preparation prevents poor performance. And so when we repeat and we do this dissection of the questions over and over again, your default setting becomes, hey, okay, pause. Let me get to the stem. Let me eliminate 2 wrong answers. So we go through that in our part 3 of our class today. But the very first thing we start off with, so let me say again, welcome. I am delighted that you are here. And what I've found in working with almost 500 students now, yeah, a little over 500 students now actually, is that there are really different types of schools out there, right? There's different types of massage schools out there. Some of you were almost left to your own studying in class. Some of you had days where you showed up to school where there was no instructor, and you were told to go ahead and read the next chapter, to do written exercises. And that can feel really deflating. That can feel like, whoa, am I really ready? Did I get enough learning? Well, we're here to learn, but we're also here to remember that being a massage therapist is not just a job. If you were in this for just a job, you would have way moved on by now. Yeah, for real. If this was just a job for you, you'd be like, next. This stuff you can do that's a lot easier. A lot easier, but a lot less meaningful. Each of you have been called to facilitate a healing space through massage, through energy work, through Reiki, through body work, through whatever modality that you're going to practice. But this becoming a massage therapist, it doesn't happen here. Mm-mm. It happens here. And if it's not happening here, I'm touching my heart for those of you who are listening. I said it doesn't happen here in your head. Becoming a therapist happens here. And we could spend a lot of time talking about your journey through massage school and how that changed you. So many times, graduates of massage school tell me, oh my gosh, I was in a relationship when I started school, and then I was not in a relationship when I finished school. Or I was single when I started massage school, and then I got into a relationship, a first healthy relationship of my life, right? Massage school, becoming a massage therapist, is a perfect path. It's a beautiful path to your evolution, to your soul's unfolding, to the life lessons that you are welcoming into your life. Is it bumpy at times? Yeah. But it's not out there. What's happening for you in your process of becoming a massage therapist is not out there. It's in here. Honestly. This is a part of our journey, the mindset of a massage therapist. And that's part of the reason that I facilitate this class, that I offer this class, is because at times massage schools have left out a couple things, not necessarily about client assessment or the benefits of massage, but they may have left out the why, your why. And so no matter how many times you take this test, I don't care. It's about your why. We've talked in the past about failing forward, that if you fail the MBLEX, it really doesn't mean anything except next. Now, we pause, we grieve, we're upset, we pause and we feel what we're feeling. I'm not saying to ignore the feelings you have if you've failed the MBLEX. It's fine. Those feelings are valid, real, and they're there for a reason, to stimulate some change, to stoke that fire in your belly, to doing what you came to the planet, at least in part, to do. And this whole journey may be about one client. This whole journey may be about you being a licensed massage therapist to help just one person. Might be. Or about one person helping you. But what I wanted to share with you today about the MBLEX is that the MBLEX is part of a process. It's a part of the process that is I want to say the unfoldment, but I will say the unfoldment of who your soul has come here to be, but really the evolution is probably an easier word to understand. The evolution of your next life lesson. In fact, you guys may know that I'm writing a book, and the book that I'm writing is called The Body Blueprint. The message in the pain, how your pain may be telling a story. I'm talking to the reader about the message in their pain. And my ideal reader is someone going through a kind of a life crisis, kind of a tough situation, and they don't know why. They have a sense that this is happening for a reason, but they don't know why. And, I really feel like that speaks to us in this room. That, as you prepare to pass the MBLEX, you may have bumps and lumps. You may have, like in one case, moved from state to state. And now it's like, holy mackerel, I have to pass the MBLEX? I've been out of school 10 years. Oh my gosh, I've failed the MBLEX a few times. But there's some bumps and kind of like not all smooth sailing along the way. And so you may be wondering, why is this happening to me? Why is this happening right now? Like, I just want to get on with it already. Please understand that it's not happening to you. It's happening for you. just a few pearls of wisdom that you're going to get out of this process. A few pearls of wisdom that you're going to bring into your treatment room. That's going to make all the difference to your clients. It's a part of your process. This isn't happening to you. It's happening for you. For real. And so that is why it's a perfect process. And we have to do our part, right? We can't just stare at our belly button and, say Om, right? Om. That's not going to do it. We got to do our part, and you're here to do your part. You're listening now, doing your part, and that is honored. That is honorable in the universe. In my world, there's a higher power, and that universe right now is rearranging on your behalf. No matter what you see before you, the universe is rearranging on your behalf because of the intention you have set to become a massage therapist. Because of the intention you have set by being here, by listening to this. So just know it's a perfect path. That's the truth. And it's also, I'll stretch just for a second to say it's also the truth that you are perfect. You are perfect in every way right now, today. It's impossible for you to be any way else. You are showing up uniquely as the incarnation of you. That higher power expresses through us as us. Whatever creative force you believe in the universe, that shows up through us as us. So you must be perfect. Just a few lumps and bumps along the way. All right. That's my truth, and I'm sticking to it. That's my story, and I'm sticking to it. Let's do a little learning as we transition into the education part of our lesson. Today, we get to do ethics. So many of you have this. I got to share my screen first. So many of you already have this. And for those of you who've taken the MBLEX, you've told me, oh my gosh, I scored so well on ethics, boundaries, laws, regulations. That's cool. That's great. Let's review it because it's an important part of the test. Not everybody does well on it. And not everybody comes to the experience of being a massage therapist with a ton of life experience. The more life experience that you have, the easier ethics, boundaries, and guidelines to a professional practice is going to be. Yeah, the more life experience you have. So let's go ahead and get the party started. Oops, I forgot to change my view. All right, there we go. Thanks for your patience. You would think after the 900th time of doing this, I would get it down. All right, from our current slide. Yes. Hello. So as you can see, we're talking about roles and boundaries. Now, if we were talking in terms of two different, so we're talking about ethics. Ethics, guidelines to a professional practice, terminology that has to do with clarifying our role as a massage therapist and our boundaries in the treatment room. Okay? We cover roles and boundaries, ethics, and guidelines to a professional practice because it's 30% of your test. Yeah, an average of 31 questions out of 100 are about categories that fall under the umbrella of roles and boundaries, ethics, and guidelines to a professional practice. So today we're talking about roles and boundaries. And you see here in front of you a fence with some barbed wire on the top. So if we were talking about two countries, this would be the fence that designated the property line, the where one country started and the other country stopped, right? Where we go and where we don't go. So if this was a junkyard and there was a big dog behind that fence, This would be, okay, that's a boundary. We're safe on this side. We're maybe not so safe on the other side. That's what boundaries are created for safety. Boundaries are created for professionalism, to say, yes, this is professional. This is not. So we get very clear on our boundaries. So let's take a look at a few words that are related to boundaries. Our first word is transference. So we're going to talk about two versions of this, and this is transference and countertransference. They can be a little tricky, but this transference comes from the client to you. So sit with that for a minute. Transference is from the client to you. Client is typically transferring feelings from a different experience to this session, to you. Sometimes it is childhood, oftentimes it is childhood experiences, but these are feelings that are related to a very significant part of your client's life. And sometimes, because the nature of massage is nurturing, because the nature of massage is safe, these feelings can bubble up. Now, it is transference sometimes is a part of the client's healing journey. I guess it can almost everything we experience, right, is almost always a part of our healing journey. But transference is from the client to you. They are transferring an emotion, a feeling, a thought, a truth, an axiom, something they've always thought was true. And they're saying, oh, well, because you're touching me, you must like me. Mm-mm, mm-mm. You know what? I've had a lot of clients on my table I didn't like, for real. But you know what? It's my job. It's my job to leave my opinions, my childhood experiences, my feelings, my thoughts, to a certain degree, at the door, right? So the client may be saying, oh, you're touching me, you must like me. Or, oh, you wear your hair just like my mother used to wear my hair, her hair. Ugh, you know, and sometimes this can be on different levels, right? The transference can be triggered by different things. It can be triggered by a smell. And this is why we're so intentional about burning incense, wearing a fragrance. Guys and gals, if your massage instructor did not instruct you about our five senses and how those impact the treatment room, let me assure you that transference can happen because of a sound, a smell. No perfume in the treatment room. Mm-mm. And be careful of your shampoo. Be careful of your deodorant. Does it have a smell? If you choose to smudge or burn incense, know that not only could a client have an allergic reaction, but they could trigger a feeling of transference, an incident of transference. Oh, did you just burn lavender? Ugh, my grandmother, she used to burn lavender. So we always have to ask permission about aromatherapy, about is this environment comfortable for you? Is there anything in this environment, especially if you feel transference happening, is there anything in this environment that is reminding you of something? This is where transference comes from. Sights, sounds, smells. Rose, a big no-no for me. I'm not interested in a floral smell at all. Um, it could be, it triggers just old, like, memories of, like, well, of grandparents, right? Which actually is really nice, but I just don't like the smell. So just know that it can be, transference can be, it is perceived to be a negative thing, but it's just a thing. So Typically, it can be seen as a negative thing because typically the client is trying to transfer something onto you, meaning you're responsible for this feeling. Know that the boundary is that you are not responsible for that feeling. You are responsible to observe that feeling, to observe what's happening with your client and not take it on. Enough about that. Our next topic speaks to the other side of things, countertransference. So transference and countertransference. So this is countertransference is from the massage therapist to the client. Client walks in and is wearing the cologne that your father used to wear. Your client walks in and is wearing a leather jacket, um, pointed cowboy boots, several piercings and visible tattoos, and you've got a feeling. First of all, you're stereotyping, right? You're immediately stereotyping. Have you ever been stereotyped? Has anyone ever looked at you and said, "Oh yeah," and especially like if you're, practicing massage right now, uh, practicing, not legally, not in an office, but when you see a client, have they ever sized you up and been like, I had a therapist, a oh golly, she was all of 5'1", I think. She was not real tall. She would call herself diminutive. She was a little thing, and she was part of a practice. She's a licensed massage therapist, and when we talked about stereotyping, she said, "Jody, all the time, people look at me and say, ugh, she's not going to be able to do anything for me. She's so little." But have you ever been stereotyped? Yeah, based on what you're wearing, where you live, where you shop, where go out. Obviously, color of skin, color of hair, language, I mean, there's all sorts of things people stereotype about. How did that make you feel? Yeah, right? You might have felt something. And we bring this back to countertransference because if your client sizes you up, you may be feeling something about that, which has nothing to do with that client. It has everything to do with the 100 times before. And so we're going to identify that in ourselves when we feel a certain way. We're about to counter transfer a feeling, meaning we're having a feeling and we're pointing it at them. And it could be about what's happening, but it could be about our history. Unresolved things from our childhood. Sure, that makes it so dramatic, but it just is a thing. And we have to monitor it in ourselves. So what do we do about stereotyping? What do we do about countertransference? Awareness of it is usually curative. Let me say that again. Awareness, self-awareness, usually cures the situation, is curative. It cures the situation because all of a sudden you're like, oh, I'm totally stereotyping that guy. Guy walks in, leather, boots, spacers, tats, maybe a nice skull ring on his finger. Oh, you got him figured out, don't you? No, you don't. Oh, no, you don't. You have no idea. That client is presenting in a certain way, but that has nothing to do with once you get him on the table. You're thinking, oh, he's going to want deep work. He's not going to be very nice. Whatever. It doesn't actually matter. We're counter transferring. We're stereotyping. And that's bringing up an emotion for us that we're imprinting on our client. I had a countertransference moment when I spoke with this wonderfully elegant French woman. I was like, oh, how nice. This woman gets massage all the time. She's visiting the US from France. She's going to be my client. I get her on the table. She gets herself on the table. I walk back in the room. I do my little grounding. I walk back in the room. And you guys, for real, when I got to her arm, and I lifted her arm, there was a fragrance that emitted that I can recognize as something that comes from a sebaceous gland. Are you laughing? Yeah. Her armpit smelled, and her armpit was full of hair. It's very French. Don't shave their armpits. I had a feeling. I had a point of view about that. I was like, what? But because I had grounded before I walked in the treatment room, because I come from a point of understanding stereotypes, I was able to be self-aware enough to catch myself and be like, you just stop your judgmental little yuck moment. It's not yuck. It is what it is. Now, I did press her elbow firmly to her side and continued work on her forearm. That was my choice. But I had a moment to avoid a countertransference. I might have copped an attitude. I might have been like, ugh, I'm not even working on her other arm. That's not who we are. That's not how we roll. That's not the safe, non-judgmental space that we facilitate for people. Countertransference, an emotion that the therapist might transfer to the client. Roles and boundaries include the practice of maintaining our best self. We refrain from using illegal substances or using alcohol, and we ask that same of our clients. Now, if we feel like our clients are under the influence of something, obviously we are not under the influence of anything. If you've got a prescription, that's a different story. But we are staying very clear in our treatment rooms as practitioners, as massage therapists. We're bringing forth our best self, but we always have the opportunity to end a session or to not even start a session if we feel that this client is not in their right mind, meaning that they've been using alcohol or drugs. And even during the session, if you determine from a smell, from behavior, this translates not just to drugs and alcohol, but we've talked about sexual impropriety too. You always have the right to terminate a session and to be paid in full. Scope of practice, we've talked about standards of practice in the past. We're going to talk a little bit more about scope of practice and what that means. Just understand the limitations of being a massage therapist. You're not a counselor. You're not a nutritionist. You're not an exercise physiologist. You're not a personal trainer unless you are. Yes, unless you're licensed. So we have to understand the scope of practice, the limitations. So, it's best when we identify if this client could benefit from seeing another licensed healthcare professional. We need to frame that in very carefully. There are no needs or shoulds. Remember, we have eliminated the word should from our vocabulary. You don't should on yourself. You don't should on others. There are clients, though, that are open and ask, oh my God, I got to work through this issue. And we can reflectively listen, something called reflective listening. We reflect back to them. Wow, it sounds like you might benefit from talking to somebody about this. Sounds like you're ready to talk to somebody about this. Oh my God, I'm really working with this tough issue. Can I talk to you about it? Certainly you can talk to me about it, but it's out of the scope of my practice to give you any advice. I'm a great listener. And depending on what they share with you, you may really understand at that point they're ready to see another licensed healthcare practitioner, a psychologist, a psychiatrist. And so at the end of those are great colleagues to have for referral. Or you can simply say, hey, it sounds like you're ready to talk to somebody more about this. Lots of my clients see a counselor. They're technically called a licensed clinical social worker, but a counselor, a psychologist, a psychiatrist. And delve into your own heart and see if you have any stigmas around that. For a while, I did. I was like, you've gone to see a psychiatrist? For what?" I mean, because I was like, "Are you crazy?" But then I dated a fella who his dad is a psychiatrist. And he was like, "Jody, everyone in my family has been to see a psychiatrist, including my father, who is a psychiatrist." And that, popped the bubble for me. I'm like, "Oh, totally healthy people go and do talk therapy." And I would offer that to you. Totally healthy people go and do talk therapy. And we're in a beautiful time of life right now where mental health is really so much more talked about now. Used to be a real dirty little secret, right? If you were seeing a counselor or you were doing talk therapy. Not anymore. Whether it be US gymnastics or soldiers, or many different people who have brought forth this importance of mental health. So our scope of practice is not to practice mental health. Our scope of practice is to stay within those navigational beacons, within our scope of practice of treating the musculoskeletal system and reflectively listening with a kind heart if this client is ready, would benefit, and is ready to be referred out to another licensed healthcare professional. We've talked about these standards of practice, so I'm going to go ahead and pause there for a moment as we skip through some of those, and just take a look at for comments. Here we go. Welcome. Yes, yes, and yes. Thank you so much. Yes, good. I agree. And we've got a few more slides that I'd like to share with you on this, but this is not. Oh, okay, I see where I'm going. I was like, that is not what I thought was going to be happening next. Let me continue to share my screen, and we'll finish up with. I thought we were going to delve deeply into the prevention of sexual misconduct, and that is not. We've already been there, so if this is a reminder for someone who hasn't seen it, don't have sex with your clients. Here's the only exception. There's maybe 2 exceptions to that. You want to hear them? To not having sex with your client? What are the exceptions? Put it in the chat. You guys know this. I'm not going to tell. I'll tell you afterwards. What are the 2 exceptions to having sex with a client? I will watch for it in the chat. Go ahead. Tell me. Tell me. Tell me. Oh, boom, Betsy. Yes. If you already have a relationship with them prior to becoming a client, meaning you've already had sex with them. If they are your husband, you don't have to stop having sex with them. If they are your wife, you don't have to stop having sex with them if they are your client. Boundaries, boundaries, boundaries. No sex on the massage table. No sex in the treatment room. Yes, exactly, Lynn. Good. Yes. And then there is one other exception. The AMTA says that if you are wildly attracted to a client and that client is wildly attracted to you, the recommendation is to wait 6 months. Since if you met them for the first time on your treatment table, wait 6 months. No, they cannot be your client. They have to stop being your client, and you have to wait 6 months. That is just a general guideline. It is not a law. Yeah. I know the 6-month BS, right? I know. But we are recording. I think we're recording. Yeah. So just know that that is the recommended guideline. If you find but here's the most important part of that equation, whether you wait 6 months or not, they can no longer be your client. It's just, it's like a teacher and a student, you guys. So we've already covered this, so I'm going to continue on. We have a few more slides to cover in the time we have today. So let's move it on. It takes 20 years to build a reputation and 5 minutes to ruin it. So just know that if you think no one's watching, no one's going to know, you never know. act as if that everyone will know, and ask yourself if that behavior is worth it. All right, let's move through a couple definitions and then we'll move into our questions. Ethics are the moral principles that govern a person or a group's behavior. We've talked a little bit about this in the past, but ethics are principles. Ethics are moral principles, and a lot of these words are interchangeable. So I just like to refresh your memory. Ethics kind of govern behavior. Are they written laws? Sometimes they turn into written laws, but ethics in general are principles that govern behavior, and they're internal. As we get into a little bit of the code of ethics, dual relationships is another definition that I wanted to offer you today. We've talked a little bit about it in the past, but dual relationships happen when you've known a client prior to them getting on your massage table, as we've talked about. So dual relationships are either you had a relationship with them in the past, or you see them after they became a client, and you realize, oh, we go in the same circles here. So either prior to or after, you find yourself in a situation where you're seeing a client and the role of therapist client is not, like, they're not at your office. We have some rules that govern that. And I believe the rest of these slides go into those rules, but we're right at the time where we normally transition into questions. Let me just take a peek. You can do a lot of reading on massage and dual relationships. There's great articles out there. You can check back on this. I'll put the link to this article in our patron site so that you can read it if you're curious. This is how we deal with dual relationships. And we've actually talked about that. We're not going to go dive into that now. Those are the definitions I wanted to share with you for today. All right, questions, comments. Let's see, we've got a few comments in here. Thank you. Yes, be careful. Thank you, Riva. Be careful because some books say 3 months. Yeah, very good. And really, if you get a question on this ethical dating your client thing, just go with the most conservative answer. That is absolutely what a good rule of thumb. Go with the most conservative answer. So if you get 3 months or 6 months, default to 3 to 6 months. Again, this is a little bit of a moving target because things change. Excuse me. But yeah. So dual relationships, transference, countertransference, ethics. Just wanted you again to stir that brain and remind you of kind of what your point of view is on these hot topics for your practice, in practice and in the test, right? All right, looks like we're clear on questions. Let's go ahead and move into dissecting some questions. All right, so we're gonna go in a kind of a different direction here. I'm gonna do some pathology with you today on the questions. This is intentionally switching gears in your brain. What happens in the MBLEX? Do you get 10 anatomy questions and then 10 pathology questions and then 10 business and ethics questions? Nope. That's right. Nope. Yeah, nope, you sure don't. They are all over the map. You may do a deep dive into a client assessment question, and then all of a sudden they're saying, what's the difference between a C Corp and an S Corp? What? Right? So we're gonna do a little bit of that now, and this happens with your practice exam in the Online Learning Center. Thank you so much, you guys, for all of your feedback on the Online Learning Centers, especially on the practice exam. This month, we've been really proactive in going through the questions and making sure that that they are really serving you, and they reflect There's 1,600 questions in there now that we go through these questions on a quarterly basis to make sure that they really serve you and they still reflect what you're seeing on the MBLEX. We had, yay, last week we had 2 people pass the MBLEX, but ooh, we had 2 people who didn't. And that's okay. That's absolutely okay. Actually, we had 5 people take the test, and through that, we get feedback on new developments, and a brand new development that may not be brand new to you, but may be brand new to you. There are some questions that only have 3 answers. Forever. Since whenever this test came out, 2010, 2008, something like that, that there have been 4 multiple choice answers, right? Four multiple choice answers. Now, some of the questions only have 3. And it's a little disconcerting. It's like, whoa, oh, am I missing a question? Is this the right test? Yes, it is. It's not the wrong test, unless it is the wrong test. But right now, the MBLEX is starting to initiate. Some questions have 4 answers, some questions have 3 answers. All of my questions today have 4 answers, and they are in the world of pathology. Let's go. Okay, whoops, this is not where I thought it was. Oh, hey. Well, we go very fast. You cannot read it. I was reviewing my questions earlier. All right, take a look. This is a pathology question. A tension headache is defined as A, muscle contraction headache with trigger points. B, a rebound headache. G, a grouping of headaches. D, a neurological disorder. We go through a sequential process when we have a question like this. What is the question really asking? Are there any tricks in there? Are there any distractors in the question? In the stem of the question, we all want to jump right in and go, get rid of letter C. It's not letter C. Okay, you're right. But we can't actually get to the right answer unless we examine the question. Now, a couple of people, more than 2, more like 20, have gone through the MBLEX and ran out of time. Yeah, ran out of time. You automatically fail if you don't finish. Damn. So just watch your time. Watch your time. You can take your time with questions, but you can't take too much time. Now, here's the interesting fact as you consider this pathology question. You can ask for an accommodation of more time. You can ask for more than 2 hours to take the test. Did you know that? When you make your application, you can ask for more time if you want it. Get with me one-on-one if you want more details on that. Let's go back to our question. A tension headache is defined as, so no real trickery here, right? Tension headache. Let's see if we can eliminate. What 2 answers can we eliminate? A, muscle contraction headache with triggers. Oh, we all have answers here. Look at you. Rebound headache, neurological disorder. All right, we're eliminating C because it's not a grouping of headaches. Did anyone else? Oh, look at you. Okay. All right, very good. I see. All right, very good. I like it. Charlotte, eliminate B and C. Yep. A rebound headache. A rebound headache would be considered something if you're rebounding. So are you rebounding from going off sugar, going off caffeine, changing your diet in some way, not enough water, right? So B and C out. What's the best answer, A or D? Go ahead, put your best answer in the chat, please. A tension headache is defined as muscle contraction headache with trigger points. D, a neurological disorder. I will tell you the truth, they're both right. What's the best answer here? This is a question that has a distractor. It has 2 right answers. Oh, makes me crazy. Yes. What's the best answer? Let's take a look. Okay, we got questions. I see only one. Oh, you all put your answers in there. Okay. Technically, a tension headache is considered a neurological disorder. It is letter D. Here's why. Neurological disorders is the umbrella of headaches. Yes. If we said a tension headache is a general category, muscle contraction headache with trigger points. Trigger points is the reason that the neurological disorder is the best answer. Ooh, give me some feedback. Yep, give me some feedback. I know, mind blown. Should be muscle contraction headache with trigger points, right? Common neurological disorders. This is the umbrella. Here's why. A tension headache is the most common type of headache. You probably can't see that. Hold on. There we go. Is the most common type of headache. It is pain or discomfort in the head, scalp, and neck, often associated with muscle tightness in these areas. A tension headache can be caused by all of these reasons. Take a look. Squeezing band around the head. Oh, these are different types of headaches. Tension. Squeezing band around the head, no trigger points. Migraine, cluster, sinus. This is the trickiness. So again, at the bottom here, it says you see the causes of a tension headache. Tension headache, not always trigger points. Often trigger points, not always. It is a neurological disorder. Sorry. Also, look at the causes. The muscle contractions can be a response to stress, depression, head injury, or anxiety. All right. Now, this question will make you second guess every answer that you have on the NBLEX. It will. That's okay. Both answers are right. In your treatment room, you're not going to tell someone they have a neurological disorder. You're going to treat the muscle contraction headache, and you're going to look for trigger points. This has no bearing on, this question has no bearing on your ability to give a good massage. We are learning how to take a test. You with me? All right. Sorry. All right. Another pathology question here. If a client's medication, their RX, and RX is a way to say prescription. So if a client's medication, prescription, decreases pain, what must you do to ensure your client's safety during the treatment? All right, we're going to understand the question. We're talking about a client is on medication to decrease pain. Keyword here. What must you do to ensure your client's safety during the treatment? It doesn't say what must you do to ensure your client's comfort. What must you do to ensure your client's enjoyment? This question is asking about safety. All right, let's eliminate two wrong answers. Okay, oh, we got questions. We got people answering already in the chat. I see. All right, so we're going to go through, before I look at your answers in the chat, we're going to eliminate two wrong answers, okay? Safety. Client is on medication to decrease pain. Client safety. A, make adjustments to your speech. B, wait 48 hours after the medication before giving treatment. C, use deep muscle tissue techniques with caution. D, consult a physician before the treatment. What do you know we can eliminate, right? I'm going to look at the answers in the chat. Ooh, I like it. Take out A and D, I like it. All right. Oh, okay. I see. Yep. So in this case, we are thinking maybe go with the most conservative answer, right? Consult a physician. That would be the most conservative answer, right? Let's back up just a second. Can we eliminate this one? Can we eliminate A, right? Yes, we can eliminate, make adjustments to your speech. They're not deaf, okay? They're not, there's no problem. They're not speaking another language. Oh, by the way, talking louder to somebody who's deaf doesn't work. Okay, so making adjustments to your speech, that has nothing to do with decreasing pain and safety, okay? So I've seen eliminate A and D, consult a physician. Consult a physician, you know, that's the most conservative answer. It's not the correct answer. Do we need to wait 48 hours? That might throw you. That might tempt you, right? Wait 48 hours. Okay, we'll just wait 48 hours. What if they take their medication daily? Hmm? Mm-hmm. All right. I like what I'm seeing in the chat. I like what I'm seeing in the chat. Boom, boom, boom. That's right. Use deep muscle tissues techniques with caution. Here's why. Safety, right? So we're looking at the safety of the client. So why are we using deep muscle tissue techniques with caution? Tell me, put it in the chat. Explain to me why this is the right answer. I know you know. So just bring it out. Help me. Go ahead. So the client's medication decreases pain. That has to do with their nervous system, right? I see some answers coming in. Yes. This has to do with their nervous system, right? So if a client's medication treats their pain, it treats their nervous system. It treats their peripheral nervous system. It's treating it, the medicine is going into their central nervous system, but it's treating their peripheral nervous system, right? Good. Yes, exactly. Lynn, yes. Jewel, yes. Yes. It's the yes. So the proprioception, right? Our ability to feel, to propriocept, there are neural receptors could potentially be a little less sensitive. Have you ever had the experience where part of you is numb? Right? Like say you went to the dentist even, like, and they numbed your lip. And you're like, "Oh." And the dentist says, "Be careful because, just be careful if you're chewing because you won't feel if you're biting the side of your the side of your cheek." Right? So that is why we need to be careful in using deep muscle tech. What is the problem? Why are we using caution with deep muscle tissue techniques? If they can't feel how deep it is, come on. Yeah, I know you're saying it out loud out there, but it's not in the chat. I can't hear you. Yes, yes. Okay, thank you for sharing. I love it. Yes, you can harm them. You can do damage. You can cause bruising. I mean, I've bruised a lot of clients in my life. I'm sorry to tell you, that's not necessarily a heinous thing, but we do need to use caution because it can be very upsetting to the client if you have bruised them. It's not our intention to bruise them, but if they can't feel properly, we can actually damage the tissue. We can cause more harm. Yeah. All right. Well, we're at our 1 o'clock moment, so I'm going to stop the share and we're going to move into some questions. So let me just say before we get into our live questions, we'll take a few minutes of live questions and then I'll stop the recording and do my little outtake. So go ahead and ask the questions. Open your mics if you like. Turn on your cameras. Let us see your beautiful faces. Yes.
I have people decide to mow all of a sudden. Okay, I'm getting a little confused between proprioception and noroception. My understanding of proprioception is movement. I mean, like being aware where movement is happening. And noroceptors being pain. But I'm starting to see a little confluence with proprioception in relating to pain. I'm a little confused.
Yes. Okay. So great question. So proprioception is our feeling of knowing where we are in space. So we have questions about our inner ear and how that affects our proprioception, right? So neuroreceptors is a noun. It's a person, place, or thing. They are in our nervous system. So you are absolutely right. Our neuroreceptors are sometimes numbed, not completely numb, but the sensitivity isn't there if someone is on pain meds. So you're absolutely right at that. However, at times we will be asked about our proprioception in regards to our peripheral nervous system. So just know it's still asking about your place, your sense in place in time, not in time, but in space. But it can also refer to your ability to feel.
Could you do a hypothetical scenario of the proprioceptive in regards to the peripheral nervous system?
Absolutely. So, so the pathology could be someone has diabetes, untreated diabetes. And so with untreated diabetes, sometimes a client can lose the sensitivity in their extremities, specifically in their feet. Unfortunately, we hear about untreated diabetes causing amputation, just because they don't know that they have a wound on their foot and the wound gets infected. Okay. So in the sense that their proprioception of their foot had been diminished. So their brain's ability to neurorecept, to uptake, so their proprioception of their foot was lost. In fact, and does that make sense?
The awareness of the foot.
Exactly. Their ability to perceive their foot.
Mm-hmm.
Yeah. Their peripheral nervous system was quieted. It was somewhat numb. It was affected by their diabetes. Not everybody looks at, their feet every day. I mean, we're looking at an older generation. We're looking at a generation that typically would be more conservative. Um, that's sometimes why that happens. It's why it's really important if we have an elderly client, that we make them aware. It's really important for not even elderly clients. I mean, let me finish on this note and then I'll wrap up the recording. We will see things on people's body that they do not see themselves. Skin cancer being one of them, or a change. It doesn't have to be skin cancer, right? It actually can be a change in the mole, right? And so that's what we bring forth. That's our scope of practice.
A B
Perfect
C D,
example. Hmm?
right? A B C D E, isn't it?
Yes, A, B, C, D, E. Yes, exactly. So, and we'll frame that in a moment. But we will see as practitioners, as massage therapists, excuse me, as licensed massage therapists, we see our clients' back. They don't often see their back. If you see a mole or a freckle changing, you can bring it to their attention. And we need to bring it to their attention within our scope of practice. Oh my God, you've got a problem with that thing. Right? No. We have to bring it to their attention with grace, with professionalism. Hey, did you know you've got a mole on your back that seems to be changing? It has borders that are uneven. Um, it had and to understand that and to understand what it looks like, and I'll bring some examples to our pathology class of moles that are changing. Because that's a wonderful additional value that you bring to your treatment room. Again, with elderly clients, they may not know that they have elderly, I say elderly, but clients who have untreated diabetes, they may not know they have a wound on their foot. They don't feel it. And so in any case, that's a perfect example of the pathology. All right, so I'm going to wrap up this. Thank you so much for This is the end of the recording. I'm staying on for another 10 minutes or so to answer specific questions, to talk about test stuff. But at this point, I'm wrapping up the recording. My name again is Jody Scholes. It is really a privilege to walk with you on this part of your journey. I am just honored, really, to usher in, to shepherd in the next generation, the next season of massage therapists. And for the therapists who are live, just know I am kind of expecting that you are going to be taking this test before the end of the year. We've got three and a half months left before the end of this year. And it is my vision, my affirmation for you that you are licensed before the end of the year. And so if you are listening to this at another time, in another space, in another place, just know that I am affirming for you too, that within the next 90 days, for you, for this group right here, my live group, the next 90 days, it's my affirmation and expectation for you afar as well, that you are taking and passing the MBLEX. Thanks for listening. Thanks for your vision of being a licensed massage therapist. You make a big difference in the world. See you again real soon on another recording.